Hi, my name is Dr. Brittany Singleton, and today I will be presenting to you Module 8 of the COVID-19 Vaccination Certificate Program, Storage, Administration, and Post-Vaccination Considerations. It will be broken into 3 parts, and this is part 3 of 3. As I said, this is Module 8 of the 11 webinar series. Please tune into the other modules for your CE credits and your certificate with full and final completion. I have here my contact information, including my email address. I would like to say I have no relevant financial relationships or commercial interests to disclose. This activity, parts 1, 2, and 3, are appointed for 1.5 contact hours by the Accreditation Council for Pharmacy Education. Today we will generally cover learning objectives 4, 5, and 7. So we'll be recognizing the common side effects and rare adverse events associated with the COVID-19 vaccines, employing key counseling points to share with patients while addressing frequently asked questions and misinformation, and lastly, we will review protocols regarding COVID-19 vaccination, including documentation and reporting requirements. I want to remind you all that this is rapidly changing information, and this presentation is current as of December 15, 2021. Post-vaccination considerations. So, we have vaccinated the patient. Now what? Let's talk about documentation. As we know, each vaccinated patient should receive a CDC COVID-19 vaccination record card, as pictured here to the right. This card documents the patient's personal info, the vaccine product they were given, with a specific lot number and expiration date, as well as the date of vaccination and location or facility where it was given. There is space to document about 4 separate vaccinations on the front of the card. If we were to turn the card around, we will find additional space for a second dose reminder. So by filling out the second dose date at the time of the first vaccination, the vaccination record card can serve as a patient reminder or a recall method. Now, people do lose these, so you may want to encourage patients to take a picture of theirs. If a patient loses their card, they may come asking for a duplicate copy. If you were their original vaccine provider, you can generate a new one for them. I would recommend always checking the electronic record to confirm they have actually been vaccinated, because as vaccine mandates are growing, so is the dishonesty surrounding these cards. In the state of Louisiana, we also have the LA Wallet mobile app. It serves as a digital driver's license, but it can also retrieve a patient's digital COVID vaccination record from the Louisiana Department of Health immunization database links, which we will cover next. The next documentation requirements are within the medical record and the state IIS. Providers must document COVID vaccine administration in the organizational medical record system within 24 hours. The documentation must also be reported to the jurisdiction IIS, or Immunization Information System, as soon as practical, but no less than 72 hours after vaccine administration. All COVID-19 vaccine providers in Louisiana should be enrolled in the state IIS called LINKS, which I believe stands for Louisiana Immunization Network for Kids Statewide, LINKS. While I do not have personal experience using this system, my research indicates this site can also be used for ordering the COVID-19 vaccines and for COVID vaccine mandatory inventory reporting, which makes it a great one-stop shop. I'd like to talk about a few post-vaccination monitoring tools. The first one is vSafe. vSafe is a smartphone tool from the CDC that uses text messaging and web surveys to provide health check-ins after vaccination. These check-ins are daily for 1 week, then weekly for about a month. The app also will check in at 3, 6, and 12 months after a patient's last primary series dose. Patients can report side effects through this app. It can also send them second dose reminders. So this is a nice one. Another CDC second dose reminder tool is VaxText. VaxText is just what it sounds like, a text messaging service to send reminders. However, this one will be discontinued in 2021, so if anyone was using it before, they should focus on enrolling their patients into vSafe. Another important and familiar reporting tool we have is VAERS. VAERS is the Vaccine Adverse Event Reporting System. It's co-managed by the CDC and FDA, and it accepts and analyzes reports of adverse events after vaccinations. Remember, anyone can report these events, including patients, but healthcare professionals are encouraged to report any clinically significant adverse events following vaccination, even if you're not 100% sure that a vaccination caused the event. You should also be reporting any vaccine errors at this time. Now, there are a number of events that you must report, you have to report. This includes severe reactions like anaphylaxis, syncope, or any significant acute complications. Also CIRVA, remember the shoulder injury related to vaccine administration that we discussed earlier in part 2, you would have to report that. Specifically as it relates to COVID-19 vaccination, you must report if an incorrect product is given for a second dose in a primary series, if a patient develops multisystem inflammatory syndrome, or if a patient develops COVID resulting in hospitalization or death, if you happen to be aware of that unfortunate fact. Now let us discuss some common side effects of the COVID-19 vaccines and some of the rare adverse events that can occur. Now that hundreds of millions of COVID vaccine doses have been given, so far we know that the vaccines are safe for most patients and that severe side effects have been rare. However, there are some common post-vaccination side effects to counsel our patients on. Patients can expect to have pain and redness and swelling at their injection site. Some patients may also develop a reddish skin rash around the injection site, but this should resolve with time. Remember, all patients should be observed for at least 15 minutes post-vaccination and for 30 minutes when there are reasons for extra precaution. Patients may also feel tired, have a headache, muscle pain, chills, fever, or nausea. It's not recommended that patients take any over-the-counter medications like ibuprofen or Tylenol before vaccination to prevent these effects. It's been documented that patients may experience more side effects after the second dose of an mRNA vaccine, so we can counsel our patients on that possibility. If patients have no contraindications, they may take Tylenol or NSAIDs such as ibuprofen to treat their symptoms after being vaccinated. They should be told to exercise their arm to reduce pain and discomfort. They can also apply a clean, cool, wet washcloth over the arm that was injected. And if they're having fever, they can simply drink fluids and dress lightly to help with that. Now that we have discussed the common post-vaccination side effects, let's take a look at a few rare adverse events that can occur post-vaccination. The first one we'll discuss is myocarditis and pericarditis. These rare heart wall inflammation syndromes are concerns with the mRNA COVID-19 vaccines. There's growing evidence suggesting that these occur more often with the Moderna vaccine than the Pfizer vaccine. The groups at highest risk for this would be the 12 to 29-year-old male patients within the first week after receiving their second dose of vaccine. So we as pharmacists should be looking out for complaints like chest pain, shortness of breath, fluttering or pounding, tachycardia. Luckily, most patients have only been hospitalized for short periods and most achieve resolution of their acute symptoms, but it is recommended that these patients not be given a subsequent dose of any COVID-19 vaccine. So these patients should not receive a subsequent dose of any COVID vaccine after this has occurred. A second rare adverse event would be thrombosis with thrombocytopenia syndrome, or TTS. TTS is most often seen after vaccination with the Johnson & Johnson vaccine. This rare effect involves acute venous or arterial thrombosis in unusual locations like the cerebral venous sinuses or the hepatic portal vein. Patients will also have new onset thrombocytopenia. The group at highest risk for this would be women ages 18 to 49, and we should be looking out for complaints like shortness of breath, chest pain, leg swelling, abdominal pain, severe headaches, or blurred vision, bruising, or petechiae. Now, it's recommended that these patients who have TTS not be given a subsequent dose of the Johnson & Johnson vaccine, but they may receive a booster dose of an mRNA COVID-19 vaccine 2 months following their original dose after their clinical condition has stabilized. A final rare adverse event would be the Guillain-Barré syndrome. This debilitating neurologic syndrome is also most often seen after vaccination with the Johnson & Johnson Janssen vaccine. The highest risk has been observed in males aged 50 to 64 years old, with the symptoms of Guillain-Barré beginning within 42 days after Johnson & Johnson vaccination. We should be looking out for complaints like progressive weakness or tingling in the legs or arms, difficulty walking, speaking, chewing, swallowing, vision changes, and loss of bladder or bowel control. It's actually recommended that patients who recover from this syndrome may receive a booster dose of an mRNA COVID-19 vaccine 2 months following their original dose, or they may booster with Johnson & Johnson. It is, however, recommended to consult the patient's clinical team and the neurologist beforehand. Let us now move into some key counseling points regarding vaccination. We've already discussed the common side effects from vaccinations that you would share with your patients. You can let them know that these common side effects are a result of their body responding appropriately to the vaccine. The common side effects should resolve within 1 to 3 days post-vaccination, and you can remind patients to contact you if they are having unresolved side effects. Don't forget to give them second dose reminders. Patients can also be counseled that it takes about 2 weeks before the vaccine has its full effect. That means it's still possible to get COVID-19 soon after vaccination. So they should continue precautions in public places such as wearing a mask, cleaning or sanitizing their hands, and social distancing. Let us now cover a few frequently asked questions that you may receive from patients. We've just discussed the time it takes for the vaccination to become fully effective. A patient may ask, how long does the COVID vaccine protection last? Okay, this is a difficult question to answer, but you can let patients know that recent studies show protection against the virus decreases over time, and at the moment, a 5-month vaccine booster is recommended. Patients may ask, do I still need to get vaccinated if I've already had COVID-19? The answer is yes, it is recommended to receive COVID vaccines after symptoms have resolved and or you have finished isolation. Okay. You can also remind the patient natural immunity from having COVID-19 is not as strong as the immunity that's going to be offered by the vaccination. So they should be vaccinated. Many patients may ask, can I be vaccinated with different brands of the COVID-19 vaccine? The answer is yes and no. So you can say no. For your first dose, the Pfizer and Moderna and Johnson & Johnson vaccines are not interchangeable. But you can say yes, you may be vaccinated with any of the 3 available vaccines as a booster dose, although boosting with the mRNA COVID vaccine is recommended. Patients may wonder if they can still be infected with COVID-19 after being fully vaccinated. The answer is unfortunately yes. Some people who are fully vaccinated against COVID will definitely still get sick because the vaccines are not 100% effective against COVID illness and new variants continue to emerge. One important point to mention to patients is that the COVID vaccines work to help them from getting seriously ill, being hospitalized, or dying, even if they do happen to contract COVID-19. people believe that the COVID-19 vaccines can change their DNA. Remind your patients that the COVID-19 vaccines do not change or interact with DNA in any way, as the mRNA and the other ingredients that are inside the vaccines never enter the cell's nucleus. Many pregnant women or those seeking to become pregnant have fertility concerns regarding the vaccines. According to the CDC, there is currently no evidence that COVID-19 vaccination causes any problems with pregnancy. The studies that brought the vaccines to market did not enroll pregnant women. However, some women became pregnant during the studies, and some have become pregnant afterwards with no negative outcomes. We know that there have been fears for quite some time regarding many vaccines in relation to pregnancy and children. However, many of these myths about harm from vaccines have been shown to be unfounded. A common concern for patients surrounds how quickly the vaccines were developed. There are so many reasons for the rapid development of these vaccines. Firstly, there was worldwide urgency and ample research in recent years. Coronaviruses have been studied before during the SARS and MERS viral outbreaks. mRNA studies have been done extensively in the search for a cure to HIV, and viral vector vaccines already exist against viruses such as Ebola. Also, a significant amount of resources were available to manufacturers, and this included the commitment from governments to purchase vaccine doses up front. This all accelerated the process, but it did not impact immediate vaccine safety measures. So heavy monitoring continues at this time for those clinical trial participants and the general population as well via VAERS and things like vSafe. Okay, so safety is being monitored. Lastly, I'd like to discuss misinformation and disinformation. The difference between the two lies mostly in the underlying intent. So, misinformation is false information shared by people who do not intend to mislead others. Disinformation is false information deliberately created and disseminated with malicious intent. Both can affect vaccine confidence and vaccination rates. We may be familiar with the prevalent misinformation or disinformation that is circulated about the COVID vaccines, focused mostly on vaccine development, safety, effectiveness, as well as overall COVID-19 denialism. This graphic I have here is modified from the UNICEF Guide on Addressing Misinformation. It details a 4-step process. When encountering misinformation from patients, the first step would be to lead with the facts in a clear and memorable way. You can warn the patient that misinformation is involved. You can then break down the fallacy by explaining why facts may have been unintentionally misinterpreted or by revealing any intentional tactics being used to deceive or mislead the patient. Lastly, you can provide correct information in the hopes that the correct information will become more memorable and trusted than the misinformation that has been exposed. Let's do a brief example together. So a patient may say, I heard that the COVID-19 vaccines actually cause COVID. Is that true? So first, lead with the fact. The COVID-19 vaccine will not make you sick with COVID. Then you can give a warning. Some people are saying that the COVID-19 vaccine will give you COVID. I have to let you know that this is misinformation and it's not true. Break down the fallacy. While you may feel sick after getting the COVID vaccine, this is a sign that your body is building protection against the virus that causes COVID. Lastly, we can redirect and we can close with facts. The COVID-19 vaccines cannot make you sick with COVID because they teach your immune system to recognize and fight the virus that causes COVID. Sometimes this process can cause symptoms like fever and chills, but these symptoms are normal and they're signs your body is building protection against COVID. After that, the patient may say something like, I see. Thank you for explaining that to me. I'm ready for my vaccine now. As we close out on this section on addressing patient concerns, the CDC has provided some vaccine recipient education and communication resources for healthcare providers, and you may find those resources at the link right here below. I have again included here some general resources for more information. In particular, numbers 1, 2, and 3 will give further details on the topics we discussed in this presentation. If you have any questions, please post in the discussion board. Thank you for your attention. And that concludes our presentation of Part 3 for Module 8. Thank you so much.